as you start to implement this thing walk me through it. It must not have been easy because there's a lot of change involved in it. People who are the doers really take pride in the work they do, and so to give it out to some other tool must have been quite a challenge. So walk me through how was that? How was that journey?
It is certainly a journey that every organization is going on and at various speeds. The biggest hurdle isn't actually the implementation of these AI models. It has actually been the initial data fragmentation and the data foundations. So, as I've mentioned, right, these life science organizations are historically they're technological mosaic, right? Their data is sitting in different silos and there's these in LIMS systems and these electronic notebooks and there's these clinical databases on the side. And so you know this from your background, right? There's data sitting in everywhere. And so this first, it really the first step is you have this unified voice challenge. First, you have to figure out if you have 10,000 pages of documentation, how do you first get everything to have a consistent narrative and a consistent voice? And that's the first part. And so to solve for that, before you even implement any of these Gen AI or agents or any such, first you have to solve for the data fabric, right? Which is again, we offer these tools to standardize all of these messy data into these single searchable sources. So I have said this many times, and I know I've been quoted on this, but I'll still say it again. You have to fix your foundation before you build a skyscraper, right? You cannot make a skyscraper on a swamp. So before you try to push forward to build, implement any of these AI tools, you have to have your data foundation set. So to answer your question around, you know, what were some of the challenges? First, having uh, for companies to first identify that it's not just buying some technology and pushing it into their company, it's setting your data foundation appropriately.